Start for grades. It's streaming.
Good afternoon, audience that is joining us from the World Wide Web. We are delayed just a little bit in that we had some council members, as you know, that have jobs that pay their mortgages that they are trying to manage. And then they will be here. So just hold tight. We'll be on mute and we hope to get started shortly.
For the record, we all have jobs. Yes, we do.
I'm going to qualify that by saying their jobs happen to be holding them up, but to Mr. Mitchell's point, yes, everyone here has a job.
Yeah.
Thankfully,
Yeah.
I'd like to keep it that way.
Yeah, keep it that way. To all those that are in the audience or watching online.
Yeah.
Apologies.
This one is for their meetings, so
Recording and unmuted and ready for your call to order.
Awesome. All right. Welcome, everybody. Thank you so very much for joining us for this special session for our February Children's Services meeting. So thanks to all of you for being here. The agenda has been duly noted for us to have one agenda item for this particular meeting. We will be talking about the family resource agenda items. So we're really excited about that. I will call the meeting to order. It is now 4:50 p.m. So thank you all very much for being here. For our members of the public, once again, thanks for hanging out with us today. Thanks for being here. There are locations on the agenda where you will be welcome to speak for public comment. So please make note of that. If you would like to make a public comment, please see Ms. Clay, the lovely lady with the scarf down at the end. And she will definitely make sure there's ample time for you to make your comments. For the council members, once again, to keep us organized, I will ask you all to please raise your text so that you can be recognized. With that, Ms. Clay, let us please do a roll call.
Judge Miller, Mr. O'Brien,
Here.
Mr. Jones,
Here.
Virginia Hannah,
Here.
Commissioner Cummings, Mr. Mitchell,
Here.
Mr. Watt, Dr. Glenn.
Yeah.
You have a quorum.
All right, we do have a quorum. Thank you very much. Let me just check in. Do we have any members that have tried to join virtually with us tonight? No? Okay. All right. So we have a quorum. We are definitely going to move forward. Thank you very much. All right, council members, the agenda has been distributed and the information about this agenda has been posted on the website. Are there any changes to the agenda?
Madam Chair, I will move the agenda.
All right, we have a motion to approve.
Second motion.
All right, we have a motion by Mr. Mitchell, a second by Mr. O'Brien. Do we have consensus on the agenda? All right, the agenda has been approved. Thank you very much. All right, it is now time for us to move to what we have come here for, to talk about the Family Resource Center management contract. With that, I will turn it over to Ms. Lee.
Yes, thank you, Chair Glenn. So we are here to look at the final draft of the contract with the selected provider, Children's Home Society of Florida. If you remember, we decided to have a special meeting to do this because we wanted to give the council time to review the contract, and we wanted to give you the opportunity to provide written input, written comments, written questions, which we have done. We provided that information to you in writing. You responded in writing. We have all of that summarized and have posted that to the website. Additionally, any suggested edits or changes that you wanted to have to the contract, whether it was at our last meeting or in writing, we have done that as well. And the 144-page contract, and that's the contract as well as the attachments you received and have with you. With that, I would like to turn it over to our procurement manager, Holly McPhail, who will do just a quick review because we are able to do some questions and answers here as well. And we also have the recommended provider here. So I'll turn it over to Mrs. McPhail.
Thank you, Director Green. And I just want to first start by thanking every member of the council for the comments that we received. They are summarized, so members in the audience or online can find those on our website or on the table outside for all of the questions that were submitted, as well as the staff response. In summary of just a high level summary of what changes were made, I just want to go over those very briefly. The statement of work has, which is attachment 1, that starts from the full contract page 16. Some revisions were made to that to clarify and detail in very plain language the intent of the new revised scope of work from the original one that was published back in August. I would also just like to commend CHS, the selected vendor, for the revisions that they were able to make after the comments that were shared at the last meeting. So now, instead of an 8-month contract beginning February 1st, it is a 9-month contract beginning April 1st to give us adequate time to ramp up so we can hit the ground running on April 1st and carry us all the way through the end of December 31st. They were also able to scale back the budget request from 620 to around 609 and some change. They were also able to increase the number of dollars going directed to the subcontracted services, which was one of the comments that was made. They went from 60,000 to about 81,000 specifically for that. And they also detailed in the narrative the details related to the subcontract with Whole Child Leon, who is also in the audience here today. Should just, I assume, to show their support. That is detailed, which was also another request that was made by all of the members, or by several members of the council. The final thing that I just want to relate to in the packet, one of the questions that was made had to do with just kind of a how did we get here, and to go through an entire chronological order of June 22nd, which was when our needs assessment was published, justifying why we even ventured down this path of family resource centers, and the education process that we've gone through as a council together to support this as a modality for service delivery and positive childhood outcomes to where we are today. In addition, and I'll pull this up on our site, one of the questions that really, that there was a lot of discussion about from the council members had to do with the idea of an incubator space here at the CSC office. There was some concern about it being located here and whether or not that was kind of a justified decision. In the response, the staff referred specifically to an attachment in the ITN, which was a list of all the census tracts. At the request of the chair, we were said to target very specific census tracts and not just zip codes, because there are pockets of poverty that exist in our community that are not just in the kind of 5 primary zip codes. So we were asked to do that. And we ended up making a map of mapping it by census tract so that everyone can actually see what that looks like. And hopefully that'll pop up on the screen for everyone. I don't know if you're able to make that smaller. But in essence, the idea that you'll see here, and this is just for one of the indicators that is included in the ITN, we did 4 indicators to help identify where those priority areas are. And so what you kind of see here is, as to no surprise, 1402 is that area of Frenchtown that encompasses most of 32304 that we're very aware is the highest need. And you'll see that there is an indicator there as one of the priority neighborhoods that we will be looking at and working to engage the neighborhood. You'll also see kind of north, which is the purple one. That one up there, that is what we're kind of calling that Macon, Sealy, Town and Country area as one of those high areas of need as well. The red one far off to the west is Fort Braden. Now on this one, we know that the numbers are not as dark as what we'll see in Frenchtown, in Macon, or even in the Cross Creek, Old St. Augustine area, but we know that because of transportation, there are some more complicated issues that are out there. And when we factor in some of those other components that we looked at, the color, if you will, would get darker. And then you'll also see clearly we have what I call the Sable Palm District, that's 1902. And you'll see that what's there is the actual community partnership school. So we have resources that are concentrated there. Another really dark area that you'll see is the 1001, 1002, and that is our promise zones of South City. When we have a $2 million investment that the South City Foundation has received to do very concentrated neighborhood engagement and resource development in that community. And then you have this kind of outlier. So as it turns out, that's exactly where we're located. The data is there to support this kind of incubator model. And the idea that we did from the first contract to this revision based on your feedback is to scale back the initial footprint of this office so that we can also do that community engagement work here along with, as we're doing them simultaneously, adding those 3 other communities to ensure that service delivery is justified and continued. So it's a smaller version. So you'll also see one of the comments was that the budget for renovating or outfitting this space was reduced by 50%. That's the large kind of overview of the contract. And at this point, I'll turn it back over to Ms. Green.
Excuse me.
Did not see you. Thank you. Mr. Jones, you're recognized.
905
The census tract 3.03 are described as blighted.
So this particular color code that you have here is the number of families that are living in poverty. And it's a rolling average from the America Consumer Survey, a rolling 5-year average. And you consistently go back over the course of the past 10 years and it continues to stay dark. There are some other areas, I think it's 1803, that sometimes pops in and out of that space. But 905 is what we might call Cross Creek. The far west line is Blairstone. The far east line is, I believe that is Appalachia Parkway. Capital Circle. Capital Circle. And then the line through the middle is actually Old St. Augustine. That's what divides the two.
So where are we in this? Just
The purple, that purple dot.
That's what I thought.
That's exactly where we are located. Technically, Hartsfield, the actual school where Hartsfield is located is in 3.02, and that's more of your Lehigh, Indian Head is right in that space, which is adjacent to South City Foundation, South City and Appalachia Ridge, which is 1001 and 1002. But that one in the middle for family poverty does not register. The other indicators that we use in the ITN to help identify these areas of need were family poverty, the number of households that are currently enrolled in SNAP benefits, gun deaths, and preterm births. When we took all 4 of those and we layered them over, that's what gave us these concentrated areas. And that is actually, it's the inclusion of preterm births that makes 2702 pop up higher. But we also know that transportation's an issue.
So these areas, what are the neighborhoods found in this area?
In Old St. Augustine?
And these children and the children who live in this area, 9.05 and 3.03 attend Hartsfield?
Some of them attend Hartsfield, some are zoned for Conley. So it's one of the only areas in Tallahassee that doesn't actually have a unified neighborhood association. You have China Grove is one of the apartment complexes that's right over there. You have all of the neighborhoods and some of the developments that are on Paul Russell before you get to Orange Avenue, that are included in that whole section.
Thank you.
Some of these kids over here, yeah.
Appalachia as well. You're right, that is correct. Thank you, sir.
Mr. Mitchell?
I want to do this. So I have several questions and I don't know kind of which order to do this.
So what I would like to do is I would like to hear from
Yes.
right, okay, and then after we hear from them, then we can go in with the questions. Okay.
And so is that the public? Because I think a lot of this, the applicant can probably
So
also answer for me.
we have invited them to.
Right, so
Yeah, right. Because I know we had a lot of questions. I had a lot of questions.
That's right.
So we wanted to give them an opportunity to present themselves to us so we can get a better feel for them. And then, so this is not public comment, this is them speaking directly to us, then we can ask those questions. Is that what?
Thank you.
Okay, all right. Mr. Jones, I see your pen is still up. Do you have another question? Okay, all right. Any other questions? Okay, so with that, would you please introduce our guests? All right, thank you. All right.
So we have representatives of the selected vendor Children's Home Society of Florida. And I'm going to start with the local and go up to the statewide. So of course, Tiffany Martin is the executive director for the Tallahassee Gainesville area. I'm going to get her new title wrong. Anna K. Hutchison, who's the former director of the Community Partnership School at Sable Palm, is now the statewide director of Community Solutions. Did I get that right?
Impact.
Community Impact, that was close. Jarvis, I'm gonna get his wrong, but he's Community Solutions, I know I'm gonna get it wrong. And then I'll get this one right though. And then Andrew Sweet, who is the president and CEO of Children's Home Society of Florida. So we will turn it over to you to, for about the next 10 minutes to present and to speak with us.
Okay, well, I will kick it off. I want to thank you. We really want to be your partner in this venture. I wanted to talk to you about why CHS, just kind of big picture here. We have been around for 120 years, but we've been here 60 years in the Tallahassee community. And we are a statewide organization, but many of our strongest board members and foundation board members came from this community. Marjorie Turnbull, Vicki Weber, Gil Zipper, Katrina Roll, Sean Pittman, and Allison Tans. They provided tremendous leadership to Children's Home Society over the years. And they're one of the reasons why our strong leadership with that board is one of the reasons why we have staying power. But we have staying power for other reasons too. And one of those is that we transform with the needs of the community. What we do today is not what we did 60 years ago or 100 years ago. And you will see that evolution. You've seen it here in Leon County, where at one time we were one of the largest foster care and adoption agencies in this community. Goes to our second staying power, and that's about research and data. We always look to where we can have the greatest impact on a child's life. And in looking at the data on adverse childhood experiences and trauma in families, we know that we can do better by kids. And so intentionally, we have moved away from some of the work we've done in child welfare to invest in solutions like the Community Partnership School here at Sable Palm. And we see that this Family Resource Center is an opportunity to take what we learned in that space and do even better by the community by leveraging what we've learned: partnerships, community voice, listening to what the community thinks is important in what's happening in their neighborhood. Being a statewide organization, we also operate like a business. Last time I was here, we talked to you about our Child Advocacy Center and the need to bridge the gap in funding. We did that because just like you in your own business would not operate a program in the red, right? Like you have to make sure it's sustainable so that you can continue that mission and that work for the children, for us, for the children we serve. So we came to you asking for bridge funding. I want to be clear though, because I think that may have led to questions about financial stability. We've been around for 120 years because we can't operate programs at a loss. And so we do our best job in the community to work with partners to try to fill that gap and bridge that gap whenever we can. When we can't, we can, and we do close programs. We've done that. It's not because we are, going out of business. It's because we know what it takes to do this work, and it has to be sustainable. Because we're statewide, we can leverage things. So we continue to operate the Child Advocacy Center, even though it's running at a loss. We can't do that forever, but we do that because we have the resources and the capacity in-house to bridge and weather some of those storms. We weathered the storm in Panama City with Hurricane Michael. Zeke, I know you remember those times. I mean, that was an incredibly challenging time. We are in it for the long term, and the partnerships we develop are for the long term. If you look at the community partnership schools, 25-year MOUs, that's what we think it takes to get generational change. And that's where we're going as an organization. I want to leave plenty of time for the folks who really are much closer to this experience, but thank you. And I know we'll have questions afterwards if you have any.
Thank you very much.
All right, good afternoon, everyone. Thank you for allowing us to be here. I want to speak a little bit to CHS as it relates to our proficiency in place-based strategies. So we believe that when we talk about our place-based strategies, it's not necessarily a build it and they will come, but meet them where they are. So when we speak to the Family Resource Centers, being in the high need communities that you all just reviewed, that speaks to exactly what we're all about. As it relates to Children's Home Society and our role in that, we don't claim to be the best in providing any service. What we like to hold our hat to is being able to be an expert convener, being able to bring everyone to the table in order to have that collective impact. The goal is for us to create and transform the communities that we're in, not to just provide transactional services. We understand a lot of times families are in crisis. I come from poverty, we get that. And being able to provide that handout is important. But really being able to collaborate with our community in order to show progress over time is what we're all about. You heard Andrea speak to that a little bit when she talked about community partnership schools and those long-term agreements. Because at the end of the day, we want our communities to be more self-sufficient. And you can compare that a lot. A lot of times when you think about traditional, transactional services, it can be led by that operator versus really coming alongside the community and collaborating with them. You can have a framework or a program that just remains the same year after year after year. Our goal is to evolve with the times, with the needs, with the leadership of the local community. And Andrew touched on the fact that we're a statewide organization. We have the ability to go not only a mile wide, but a mile deep as well. Andrew spoke on the ability for us to provide supports from a financial standpoint, but also from a systems level standpoint. We're able to compound with our progress much faster when we have folks doing similar things in different areas and being able to accommodate different communities. I come from the CPS world, so there's no way that I'm not going to speak about it. But one of the things that comes to my mind when we talk about our community impact and community solutions work and truly collaborating alongside the community is that we know that our community members know exactly what they need. In order for me to get to Tallahassee, I know I want to come here, but how I get here can be the challenge. And if it wasn't for my GPS these days, I probably would have gotten lost. But when we think about our communities, they know what they want, but the how is where that assistance may be needed. So it's really about us being able to bring people together to bolster that network. That way that they can be empowered to be on that path to self-sufficiency and doing it with them, not to them. Thinking about community partnership schools, we got this work started in 2010. We are currently funded right now by the Florida Department of Education to the tune of 11 million. It didn't start out that way. It started out at Evans High School in Orlando, where I'm a former student of. And it started with a community wanting to come together and commit to this work. That has scaled now to over 40 schools around the state of Florida and that $11 million that I shared. The great thing about it is when I think about the impact that we've been able to have, I've seen students go from being sexually abused to being valedictorians. I've seen former students of mine become employees of ours at Children's Home Society. I've been able to see across the state discipline decrease because now there are mental health counselors that are treating trauma as opposed to just punitive disciplinary measures. We've seen teacher retention increase. We actually had a teacher from Sable Palm Elementary that relocated to Orlando and said, I want to work for a community partnership school because they have the ability to just teach. And when I think about community partnership schools, I share the fact that at one point in time, I was a student at Evans when we had a 50% graduation rate. I was a teacher at Evans. I became the community school director at Evans. And that's back when we had one school. So I've been able to see it expand to these 40 plus schools around the state where we currently are today. And you all have what I consider to be the gem of the state in Sable Palm Elementary. Yes, sir. And at Sable Palm Elementary, we saw that 97% of those students utilize services offered at Sable Palm. And of the 97% of those students that utilize those services, 90% of those students saw an increase in reading and math. And a lot of that came from two things, either their parents being more involved, that family and community engagement and collaboration component, or vision services. Can you believe that if you see the board, you could actually do better in school? And maybe a lot of other folks may know that too, but they don't know necessarily how to get the resources, or they may not have the financial resources. So really being able to close that gap. And when I think about Sable Palm, there's no way that I cannot think about the individual that led Sable Palm for the past 5 years, Anna K. Hutchinson, that is now, she's done such a great job that now she's leading our community impact initiatives, which support all of our other local systems of care around the state. And she just so happens to reside in Tallahassee. As I get ready to close, because I can be passionate. But it's not just community partnership schools where we have this community impact and collaboration approach. We have a family resource center in Putnam County that is fairly new to us, but also since 2010, funded by the Children's Services Council in Palm Beach County. We have 3 Bridges programs, who are essentially family resource centers, but it's a targeted audience. That audience is for families that have children through the ages of 0 to 8, where they focus on being healthy, school readiness, amongst other things. We've been able to see that program serve over 1,300 families in the community. And 95% of those members that we serve have retention, which means they continue to come back for those services. Those are things that we want to see more of. With Children's Home Society being a statewide organization, we're able to think global, but we're able to act local. We have a statewide reach, but we have a local impact. When you think about things like vision partners that we have, or New Worlds Reading, which is a new literacy program that we have, or even working with the National FRC network, those are things that we are able to bring to local areas, but also staying grassroots with our leaders like Tiffany and Anna Kay, because she happens to reside here, to know exactly what the community needs. So as I conclude, as a proud 3-time FSU alum, we stand ready to collaborate with you all and the local community and the community leaders to accelerate the success that many of you have led in the Leon County community. And I'll hand it over to Anna Kay.
Follow Jarvis. I was just tasked to answer just 2 questions that were brought to our attention. And one was, how do we propose to serve only Leon County residents? So the future intent will be to collaborate with the CSC staff and leadership, and either with a system that's already been purchased for, or the creation of a membership database, that we would be able to put the members' addresses in and validate it so that we can see that they are Leon County residents. That's the future. In Bridges, which is also funded by Palm Beach CSC, the CSC has a census tract that the program is allowed to put their zip codes in to validate their addresses. So that might be something that we want to do in the meantime. There's all other kinds of avenues that we can go down, but I don't want to pigeonhole us into one definite way to do that. But we do think about homelessness. You know, how do we validate homelessness? And it could be a letter from the shelter. It could be something with the school district that the family falls under the McKinney-Vento Act. So all of these things come into play when we talk about membership and serving locally. If they come to one of our centers and they do not reside in Leon County, we won't push them away. We'll have resources in all of the surrounding counties to point them in the direction that they need services in. So I think that's really important to speak to with the CHS mission. And then Jarvis was able to touch on how will we expand in the high-risk areas. That's what we're all about. So I know that there's been some questions and hesitations about maybe starting the incubator, is that what we're calling it here? But I think working side by side in partnership together as we build this, it's very important to know each other and to have that support, because this is new work. I mean, that we're going to be embarking on in Leon County. So I didn't want to speak to that, but there's no joke. We're going to hit the ground running with a senior director that will oversee all 4 sites, a director immediately for this location here, and then 4 full-time family engagement coordinators. I don't want to mess up the name because we call them something different in community partnership school. So they'll be hired, and their whole intent will be able to know the communities and be affiliated in the communities, that they will go out and do the good work of community readiness and get to know the community. And this will determine all the next steps in strategic planning. So this will determine location, hour set, services provided, and it'll be able for us to prioritize immediately where we start next. So here first, then we'll what's the need, what area has the biggest, largest need in the community, and then take it from there. So hopefully those were able to answer those questions, and I'm sure there'll be more. Tiffany, did you want to?
Yeah, I just have one question.
Oh, sure.
Thank you so very much. Thanks to all of you for coming. I think this was very important for us to hear you all speak. I have one simple question that I definitely want to open up to the others, but what is your understanding of what it is that we're trying to get you all to do? What are our goals, and how are you going to help us reach it? You can just answer that for me.
The goals of the Family Resource Center is to go meet the community where they're at, to provide services and walkability so that they can come and have all the resources at their fingertips, so that it's immediately infusing them with services. And what that looks like, where the referral system and medical, dental, having providers come to the centers and be a part of that and share the space. As Jarvis had touched on, We are conveners, so we bridge that gap and bring people to the good work in, and so we can all work together.
Yeah, I just want to speak to it. I mean, very much like a community and a collective impact model. The outcomes are driven by what the community wants to see in the community. So to some extent, we could say, yes, we want to help build greater economic mobility, more self-sufficiency, greater health and wellness. All of those are great outcomes that we can work towards, but it doesn't matter unless we hear from the community first about what's important to them. So maybe a little lack of clarity on the outcomes is because we need to know from the community what they want their neighborhood to look like, what they want to have access to, and what their goals are for what they see as success and what they see as anyway. So
Thank you both for your answers. Do we have any other questions?
Are you the last person?
I think that.
I am.
Yeah.
Okay, so I think now we can move into discussion and questions.
So, what I would like to do, I know that y'all are here. Thank you so very much. If we have any questions, I would love for us to ask them some questions, and then I would like for us to go into discussions, okay? All right, let's go into questions first. All right, Mr. Jones, I'm sorry, you.
Go, Mr. Jones, you are, okay, I'll go. Dr. Mr. 4 other locations, so tell me the model that you were trying to describe, Anna Kay, when, like, this would be home base, and then you'd have, and these other locations, is all this happening simultaneously?
Like order.
Or what is the
Order.
right, the
That-
rollout, or you mentioned we're gonna have like a director, and we're gonna hire 4 coordinators, or what is it?
To go out to do a readiness, the community readiness assessment of the community, to work alongside, that's our goal, is to work alongside the community. And from there, the prioritizations of what community would need to have services immediately follow that, and then have a strategic plan after that.
So if I can just jump in, if you'll allow me to jump in, just so that I can clarify. One of the things that the negotiations team was clear was that it was important for the community to be ready to receive the FRC. And so that is why in the scope of services, bringing on those community engagement positions made up of people from that community that live in that community would be working in tandem with CHS for those readiness assessments. Once we are at a point where those assessments are done, the assessments are going to tell us where the next one needs to be because that community is ready. We can say we want to put it in Fort Braden, but if the readiness assessment says that there's still a little more community work that needs to happen before it's really ready to receive it, we don't want to put it there and they're not ready to receive
No,
it.
I just heard her mention 4. I didn't know where that
Is
is.
that a question that comes back to us or? We will?
Well, that's part of the work that they're going to do with that readiness assessment and then bring that information back to this council to determine where the next one would go.
But if they're getting the award, why would the decisions about where the subsequent centers would go if the award is given to them?
Because this is a short-term contract, number one. This contract goes until the end of December. So around October, we will have information to present to the council to ensure you guys want to move forward. And you want to move forward, given all of that data, and move forward with this provider. Once we do that, then they can make that decision, but we will never do anything without bringing it back to you so that you know what's going on. So it's not, to your point, it's not you making the decision, but we do want to bring it back so that you know in the direction the data shows.
What's your question, Mr. Jones? Yeah, I see you thinking.
No, I just, after, you gonna. We make, see, this whole recommendation that came from negotiation team runs, and so we're where we are now. So I won't even talk about that. But it was my expectation that the award for whoever would get this contract would be expected to come back and do the work, and that we would not provide a direct administrative oversight to this awardee, unlike we do anyone else who receives our awards. I understood we were using this space as an incubator, which I did not agree with to begin with either, but we're here now. But it seems to me if we have questions about the activities commensurate with this award and contract, that our director shouldn't be the one who provides that intel to us. It should be from the person for whom we've awarded the money in the contract. And so I guess I wonder, here now we have this hybrid. So I can imagine there must be some, are there long-term, is there an intent for us to increase our staffing plan to provide additional coverage since we've now assumed this new responsibility beyond what is an ordinary scope of work associated with an awardee? Right, so
Yeah, that's not my understanding, yeah. It's-
well, if we're making the decisions about where the subsequent centers are, that's not the types of decisions we make for other awarded contracts.
So the way I'm understanding this is that you all will do that, the community needs assessments or community readiness assessments to determine of our target areas, which of these communities are ready for the engagement and what their specific needs are. I don't want to put words in your mouth. That's why I was trying to ask you all to answer those questions. And then based on that feedback, you all let us know these communities are ready for this and this and this, please.
But Madam Chair,
Yes.
did we not already do that when we started our own work, where we identified these pocketed, these areas of need and light? When we went through a research-based model to identify. We even had our own listening session, so we've already done that. And that's how they are then equipped to know where the areas of need
So-
are because of what we've
We
already
did a
done.
needs assessment. We didn't do a readiness assessment. To me, I see those as two different things, yeah. So it's my understanding that y'all are finding out if these communities are ready for the engagement.
Yes, that's correct. And I think it may be helpful to kind of back up a little bit. And thank you for your questions as well. So we selected the communities that we have here on the board based on the data that we have for the census tract. So to put it in order from our original proposal, the original location was Griffin Heights in Frenchtown. And that was, again, because of the data, it was a high need area, and you've spoken a lot about that. Mr. Barber is here. Mr. Barber was the president of the neighborhood association in Griffin Heights. So I spent a lot of time actually talking to him about the needs and attending the neighborhood association meetings. So it was really helpful to see what those needs were, but also to see the readiness in that community. The next location that we selected was Macon and Sealy. A large part of it was because of all of the neighborhoods in that community, in addition to all of the schools accompanied with the data. Lastly, we selected Fort Brayton. It's in a rural community. It would give us that additional time to build those relationships in the community and to really tee it up for those services. In the negotiation process, we did have those conversations about using this as an initial location, but each of those communities, we not only selected the community, but we also selected a location to actually house the services out of, to take away that time to start to build those relationships. So as we kind of walk through this process, we've been open to make any adjustments that we need to make. Ultimately, our goal is really to serve the community. And if that means slowing the process down to walk in step with the Children's Service Council, that's something that we're really willing to do in order to get those services into the community and to really make a model that can be sustained across the county here.
Madam Chair,
If I could add a,
if I could, not part of my questions, but really to Mr. Jones's point. As a guy who was on the evaluation and negotiation team this round, I was not the first round. The negotiation team was really uncomfortable with both of the proposals. Not uncomfortable, is just not quite comfortable enough to recommend either of the applicants. And we talked about it, and it will be public at some point, once this is signed, I guess. I'm not sure exactly, but you'll hear, if you listen to it, the members of the negotiation team sort of vacillating as to whether or not to make a recommendation to the full council to move forward. And it was definitely teetering on the no. What sort of broke that to teeter on the yes was the idea of, crawling before we walk and walking before we run. The community readiness model out of Colorado State, which, by the way, if you call Colorado State, they won't give you technical assistance because I tried, but they will give you this document, and it's well done. It basically said, tell a community what they need, go out and find out what they need, and it's different than the needs assessment. I promise you. I read the entire needs assessment. I've read this. I've talked to every human being I possibly can. What I would tell you is, we don't know what those communities want. We can guess what they need based on, the services that are being sort of demanded out there, the need for things that we see with our eyes, but that doesn't necessarily mean those are their priorities. So instead of deciding to dedicate a lot of $4 million worth of resources to any 1, 2, or 3 of those FRCs, we decided, oh, Natalie, let's slow it down just a bit. Let's start here with direct supervision. By the way, it was always contemplated that there would be supervision by the CSC staff. This just makes it geographically and logistically a little bit easier because they share the same bathroom. And let's put it here and start by opening and doing a real assessment of the community where we are going directly into the community, vetting the people who serve on this focus group or the council. It was part of the Children's Home Society's proposal, so I'm not gonna get the name right, but it's a council of neighbors, and essentially ask them to work with us to come up with the needs. That would all operate out of here. While we're doing that, some services like screenings and things of that nature would also begin to operate out of here. But it is not a full-blown family resource center because, by the way, we haven't asked the people by that little blue pin what they want. So it was like, where do you start? So that was what the negotiation team, otherwise the answer was no. So yeah, that's what I hope that helps you understand why here and why was the recommendation to move forward.
Okay, before we move forward, and I do see you, Mr. Bryant, we do have a council member that has asked to join us on Zoom. So we do have a quorum in the room, but because of the bylaws, I do need a motion and a second to approve Mr. Watts to join and to be a part of this
I will
conversation.
move that Mr. Watts be elected.
So we have a motion by Mr. Mitchell. Do I hear a second? And we have a second from Mr. Jones. Do we have any consent? All right, with that, Mr. Watts, welcome. And you are now officially a part of yes, Ms. Clay, will you please mark Mr. Watts present and participating in this conversation? All right, thank you very much. I appreciate that. All right, I will now go to Mr. O'Brien and then I have a
Just a couple of comments. One is, one of the things that we're required to do in healthcare, and actually it's a federal requirement and a state endorsed requirement, is that we have to conduct community needs assessments on a scheduled basis. The reason why we have to do that is because I think for years and years, the history had been that health systems, healthcare delivery models basically assumed they knew what people and populations needed, and they would conduct activities based upon those assumptions, but they really weren't hitting the mark because they weren't really understanding the needs of the community. So that was my lesson. I think a lot of people in healthcare's lesson is that we really have to go out and understand what are the specific needs and really measure ourselves to that. So it's a little different than basically recognizing what the problems are. You really have to go from a problem perspective, really to understand the specific needs and how you get there. It's getting to point A to point B. The second thing is, I will tell you honestly, and I'm not taking away from your position, but this is a big project with a lot of money. And we're starting with the pilot, and yes, we've had a lot of questions along the way. I think we should monitor it, at least a little. I mean, more than we might normally do once there's experience and success in a relationship, proven relationship that gets established. I think on the front end, I would be a lot more comfortable, especially because that's what we are. We're stewards of this community investment. It's an investment, right? We're stewards of that, and we need to make sure that we track basically the activities of those in whom we've trusted these dollars to make sure that they get where they want. So I'm actually much more comfortable being more engaged on the front end. Again, after a long practice and proven track record, I think we could pull back some, but this is a lot of money, and it needs to be well spent.
I agree with you. So my comment, okay, this is gonna make a comment and then I promise I'll come to you. So I completely agree that a readiness assessment needs to be done because I believe you can't just go tell people we're gonna do this in your community. So I am definitely in favor of that. What my concern is, I feel as if, and correct me if I'm wrong, that when you all first applied for this, you applied to provide services immediately in a community. But now we're saying we need a community readiness assessment. And what is your level of expertise in doing a readiness assessment? Because those are two different things. I'm good at providing services, but I may not be good at finding out what needs to happen in that community. So if we're now shifting from immediately, there will be some services, I agree. But instead of full blown, which I think was your intent when you applied for this, now that we're switching a little bit to saying, we need you to assess the readiness. How well, what is your expertise in doing that so that we get valuable information so that we can now go back and say, we're ready to provide these services in the community. That's it. So I think the assessment needs to be done. Are you all able to do that? That's my concern.
It was part of it. You already have.
Yeah, and I don't mind speaking to both points as well, because I really appreciated Mr. Jones' comment. And I guess I didn't do the best job of giving more information about the collaborative leadership approach that we abide by with collective impact. So I want to start there and then maybe finish there. And it's really a different way of looking at things. If you think about traditional programming, and I don't have any visuals, but think about an inverted pyramid. So you have the funder, they give the money to the provider provides the services to the client. Very transactional, right? But to Mr. Jones' point about, hiring a provider to carry out a service to then get permission from a funder, it can almost seem conflicting, but how I'll try to provide some more clarity from that with the collaborative leadership or collective impact approach, when we play the role of the backbone, think about another visual like a puzzle piece. So imagine the puzzle piece in the middle is the backbone, and that's the role that we will play. But we're connected to the funder. We're also connected to the community. We're connected to the people that we're serving. We're connected to the people that are providing the funding to us. And it causes that transactional role to kind of shift. Now it's a lot more collaboration. We are now the leader of equals as opposed to just carrying out this task from the funder. So it really shifts how we do work. So yes, now the funder is a part of this the same way that the community is a part of this. And then speaking to your point about the community readiness and different things like that, I always compare the work that we do in community schools or community solutions to the family system. So imagine you want to have a baby, right? And next thing you know, you get pregnant, and now guess what? We're ready to have this baby right now. No, there are a lot of things that need to happen during this 9 months, and it's not just the baby growing. There are things that we now need to learn and how we shift our mindset and what that looks like. So I can even speak to the community school world. We know that community schools are international strategy. There's 4 pillars: collaborative leadership, how do we bolster traditional learning, health and wellness, and family and community engagement. So we knew what we had to do, but how we do it looks differently at every school. So we started after school programs at Evans. No kids came. Well, this is what they would love to do. Well, once we met with the kids, it was like, y'all don't have any food there, and I got to figure out how I'm gonna get my little sister home from elementary school. All of a sudden, we provided food and we provided transportation, and kids now are showing up to after-school programs. Our healthcare, we provide healthcare on campus. And we provide it during the traditional hours, the 9 to 5, and the community can come, the students can come. They said, well, how is it for the community if the hours are based on this time? We're working. So we had to stagger the hours different days. So I say that from a practical lens, like from actual experience of how we had to change while we're doing this. But it's really from when we start, it's that information gathering. And guess what? We may not be the expert on that readiness. We may have to contract with someone who can come in and has that experience, or we may have it from our local partners that we work with, like the Florida State or FAMU, people that have a lot of experience to be able to put that process in place to make sure we're doing the focus groups, meeting people where they are. We do a good job with our community leadership councils of bringing in that variety of voice, whether it's grassroots or grass tops, to help us steer as well and lead us to the right direction. But it really looks different in every community. We always say, if you've seen one, you've seen one. So that's really a big part of that, is the assets, the unique assets that Leon County has is going to be completely different than any other county across the state.
And again, thank you for your question, because I think it brings to light how we could have added more clarity to our proposal. So one of the things that we see early on is we already provide services in the community. We provide Healthy Start services, early step services. We also have a community partnership school here that has a host of existing partnerships. So we understand that although we're looking to start a family resource center, we already have established programs and partnerships that whenever that community is ready, and if there is already an identified need, we can deploy those services that are already existing through Children's Home Society. So it wasn't that this is what we are going to do, rather this is what we have available should this community identify they need these partnerships or these specific services, and to really demonstrate there won't be a gap should there be a need, an identified need for those services already in the community.
So,
Madam
well,
Chair.
let me,
So here's how, when I was doing the evaluation, and I think Ms. Martin's answer is a good answer. It was, I don't want to say it was a Chinese menu, but it was a Chinese menu. Here are the things that you could offer once and part of their proposal, their original proposal, right from the get-go, before the first one I evaluated, talked about making sure the community was ready. And getting these CLC, the leadership councils, that was part of their whole, I didn't grade either of them very high, but that was the part I thought, they get it. They truly get it. So it isn't like we've changed their proposal. What we've done is we've narrowed the focus to start a little bit smaller. And so the Chinese menu example, we're not getting the poo-poo platter to start with. We're just getting a side of egg rolls.
No, that's good. And I want to I just want to make sure they're already egg rolls. That's all I'm saying.
Oh.
Are they really good at making egg rolls? So that was my point. All right. Thank you for that.
There's one in every crowd.
Mr. Jones, I see your turn.
Yeah, I appreciate the opportunity to engage directly with the respondent. As the school board member who is the custodian of our sole community partnership school, I am very much aware of what I know has been their impact. I know that when they started on the community partnership school model, that they did just what they have described that they would do here. Subsequently, we see the types of services, the types of collaboration and partnership that ultimately netted a significant investment from the College of Medicine and FSU with now an existing community health center, and that speaks to the needs. And we also were able to populate that same school with both eyeglass services and dental services, because they were engaged with the parents and with the students and with the community in terms of identifying what they needed. So I am a whole lot more convinced of their ability to be able to respond to particularly what they described as the community preparedness that I think will be necessary. I still want there to be a clear delineation between the responsibilities of the respondent and the contract manager. So our inquiry is of the respondent, not the service council, because the service council represents the best interests of this council. They are to be the persons who are the arbiters of that what they have promised that they would deliver to us. And I asked the question again, with this model of us, of them being housed here, potentially, does that have any staffing implications for us?
So at this point, I don't see a staffing implication for us in relation to this. Now, that being said, there are staffing implications in relation to the other things we're doing. But I don't see that in relation to this. It is more, we are here, we can step in, they're quick. So I think to Councilmember Mitchell's point, it's the proximity. So it makes it easier to have those back and forth and the updates and things that you wanted. Full disclosure, my expectation is that this incubator will be successful. And when we come back to you, we will show you the success of the incubator, and then you will decide on the extended contract for the other establishment. And that moves this from an incubator model to a provider model. And so now we are monitoring in the same way that we monitor our other providers. And let me just say, our relationship with our other providers, if I had to say, it's like this. They pick up the phone, they call, we get something in, it doesn't look right, we pick up the phone, we call, something doesn't feel right, we go right over there and make sure everything is copacetic. So I expect nothing less from this relationship as well.
Thank you for that. Okay, Rob.
So talked earlier about going out into the community to see if they're ready and doing an assessment and find out what they want. Because, you know, I thought I heard you mention you already have locations. I'll use Griffin Heights as an example, like a physical location at Griffin Heights at Day Street Community Center, or someplace in the neighborhood that you're going to have like a satellite. Is that what you meant? Or?
The original proposal did request that we identify a location. So that was a huge part of that pre-work that we did, that we actually went to the community, went to locations, got letters of support for organizations saying, yes, we believe in what you're doing and we are comfortable with you doing that here at this location. However, as we continued through that negotiation process, it did become clear that those things may change. And again, like I said before, our interest is really to serve the community. So if that means that we need to shift from a location that we previously identified, although we already have that support, then we're willing to do that as long as we meet the end goal of really, again, just serving the community.
And so the $609,000 is for 8 months, correct?
For 9 months.
For 9 months, and in that budget they've laid out this what that $609,000 is going to cover, like X number of positions, and then at the end of 9 months we come back and
We start
Go
over.
forward again.
Yeah, we continue or it'll be right. It'll be before that.
In the attachment to the contract, there is a timeline, an estimated preliminary report will be presented by the vendor to the council in September to kind of have some question and answer after that discussion. In October, the plan, according to the current timeline, is that they would then present that potential continuation request, budget request for what that might look like should they satisfactorily answer all your questions in September. Again, that will be directly from the respondent of the vendor to the council.
is that budget somewhere?
Yeah, and it was in the attachment 5.
It's kind of here, Rock, you have that mine.
I don't have a copy. I have an electronic version.
Yeah, it's in there.
It is in here.
Yes, attachment 5, so that's on page
Yep.
42. It's not in.
Here, I'll
this.
give it to you. I
All right,
can't,
y'all keep.
I can't do anything.
Here it is. You can have mine.
Yeah, and I'll just add while you all are doing that, I think that's also an important reason why it's important for us to stay close to you
Hang on.
all during that incubator stage. because we're gonna be working and connecting with communities. There's not a guarantee yet, hopefully, that these centers are coming to their communities. And oftentimes, especially marginalized communities can be over-surveyed and different things like that.
What is,
Yeah.
what does that mean that you may not use, you may not be going to those communities?
I'm saying based upon the 9-month incubator period,
No.
from that period, did I misspeak?
He said, so let him explain, right?
Yeah, from my understanding, I was speaking to that incubator period from that, it's my assumption from, and correct me if I'm wrong, even on my team. After the 9 months, that's when the decision will be made if we are going to be moving forward with the additional sites.
It's gonna be made before that.
Yeah.
Technically, it's at 6 months, but.
Yeah, so for instance, let me paint worst case scenario for us, right? If we at the end of those 6 months are not selected to move forward, then there's been a lot of community engagement and connecting with the local community around what they need, their readiness. So we have to be nimble about that process as well. So they're not just surveyed or have hopes up or a promise that even CHS will deliver. So as we're doing that incubator, we'll have to be clear in our strategy and our approach that what we're doing is what we hope to accomplish. Because the very last thing that I know we want to do is go into a community and say, what do you need? Are you ready? They say, yes, yes, yes. And then, oh, that's not our job anymore. So we still have to have an interest and integrity to that community, whether we're selected or not, even if we're selected just for that incubator time period. Hopefully that makes sense.
Thank you.
Okay.
Mr. Richards.
Okay, so I have a couple, all right? But I want to start with is something, Jarvis, and I did not catch your last name. You're a triple null, that's all.
Yes, sir.
That is troubling to me. It isn't CHS. It has nothing to do with Children's Home Society. This is the Children's Services Council. And there is a provision specifically in the contract that talks about branding. I don't ever want to see, and it's not that I don't believe, I'm a supporter of the Children's Home Society. But this is about the Children's Services Council and our responsibility to this community to spend their $9 million a year and them know who the heck the Children's Services Council is. So as it's on page 5, number 19, branding, the vendor shall incorporate the use of CSC Leon branding assets in accordance with the CSC. That is true, but it's exclusive. It's not, you know, the little CHS in yellow. It's that whatever that logo is, the CSC, the tree. That's really important. To the 8, soon to be 10 of us that this community whose funding versus 610,000 or 609,000 and change and perhaps ultimately $4 million understands it's their money through an organization called the Children's Services Council that they as voters voted on and may have an opportunity to vote on again.
Yes, sir.
Okay.
Very important point.
All right.
And I have some practical experience with that as well. When we started community schools, we developed a separate logo from the school. So imagine you have Sable Palm Community School, and then you have this other community school logo. And what started to happen is people in the school were getting confused. What's the difference between the community school and the school? It's all one and the same. So even as it relates to being able to provide those services, we don't even want to get in the way of that for people to say, well, what's the difference between CHS and what are you all doing compared to the Children's Services Council? We just want folks to know that they are being served and it can be a clear line. So what does that look like today? If you saw Anna Kay at Sable Palm, you're going to see the Sable Palm, right? Every now and then you may see a CHS logo or the polo, but for the most part, it's going to be Sable Palm and Sable Palm. It won't be CHS and Sable Palm. So a very good point.
Okay. So I'll go very fast. That was like incredibly important.
Yes, yes.
Up front.
Lesson learned.
On starting at the beginning, item 3, data collection. Holly, this is kind of directed at you. It said vendor is permitted to use SAMIS to store non-CSC funded program participant data. Why?
So that's just our common language that, from our boilerplate that we use. Some of our other providers that don't have data systems, they utilize our system because they're living on spreadsheets.
Thank you very much.
Yep.
I'm
Boilerplate.
like, when CHS is on that organization.
Yeah.
Evidently, this week, I certainly can speak to this. You may not have picked the right time to come and ask for 250,000, but you certainly have the ability to store data. All right, I'll put it this is. Madam Chair, I apologize. I'm going as fast as okay.
Scope of work?
Going to attachment 1, intentionally engaging.
Page.
I'm sorry, page 16. Under program design. So this is more your document than our document. This is CHS's, the program design. So again, I haven't been able to sleep evidently since Valentine's Day when I got this and reached out to Colorado State. I wanted to understand. And this has nothing to do with CHS. This has everything to do with the last 3 years of the CSC trying to find our sea legs and learning to crawl before we walk and walk before we run. And Tiffany, this is a question for you, maybe Anna Kay. But as you are putting together these leadership councils, how do you decide who are the right people? Because we're going to be paying some of them, or you guys are subcontracting with some of these folks. How do you decide who are the right people to have at the table that fully represents the communities that we're trying to serve?
I'll invite Anna Kay to answer this. But one of the things, I mentioned Mr. Barber because he was the president of the Griffin Heights Neighborhood Association. I spent a lot of time in those neighborhood association meetings listening. In fact, I spent about 6 months being present, listening to the members of the community talk about, number one, what they want, number two, what they need, and number three, trust. But what I also noticed was it was the same people continuously coming to the meeting, which demonstrated to me that they had a vested interest in seeing their community improve, but they also were interested in working with individuals and organizations that had that equal vested interest in seeing their community improve when money was never an option, when it was never on the table. And so when you ask about how do you choose, I think about number one, do you live there? Because if you live there, naturally you do have that vested interest. And number two, one of the things that I think is really important is existing engagement. Because one of the things that I learned from continuously attending those meetings was I learned about the other things that those individuals in that community were already doing. I learned about their interests. Some people cared about beautification. Some people cared about having a safe space for kids to play. And so with each person that was there, they all had very different interests, but together it was really clear that this group of people can do great work. Sometimes if they have the proper resources and support to make it happen. Anna Kay has had more experience with creating these councils and the structure with community partnership schools, so she can actually speak to those other components that don't involve community members that live there. But one of the things that was painfully clear for me is that the majority of the people that are going to be on the council, they have to live in that community because it's their voice that we need. If we're going to do a good job at providing these services, we need their voice and we need their representation.
And I will just say that I think you're right. I mean, everything you said, I agree with. I do think that there are oftentimes, though, folks who whose voice needs to be heard, but oftentimes they've never been encouraged. So you know, poor Ms. McPhail is, I know, tired of hearing you say, round up the usual suspects.
Right.
But it's you, and you get the same message again and again. I'm not saying that's not valuable. It is. But there's a group of sort of unheard. And I don't know how you find them, and I don't know how you encourage them to come out and speak. But I really think it's important. I do, and so I appreciate your comment, and I hope you'll, you know, sort of hear mine, and that. And it's not like I have anybody in mind.
I think, speak to your point, trust.
Yeah.
You know, that we're going to be here, we're going to do what we say we're going to do. And I think that that's really the success of Staple Palms and the Community Leadership Council was people want to help. I mean, they want to come into the schools, they want to provide services, they want to give you money. But the schools, their job is education. They are focused solely on getting those babies educated. And so there's not a concerted effort per se to have that one person that can take all of this community support and build a council. And so I think that you spoke to it beautifully. It's the people that keep showing up. A lot of it's grassroots, you know, giving tours, talking about the good work we're doing. It's usually somebody that they know they're like, hey, you know, I have this person who'd be perfect. It's that connector, that bridge that they might not be able to find the services or provide the services, but they know somebody with a phone call to get that. So it just depends on what the need is. Definitely, this will look a little different because it'll be, you know, largely community involvement in that. So.
But let me jump in real quick because I saw Council Member Jones. So there will be positions, Council Member Jones, that they will hire, but those positions will come from each of those neighborhoods.
Yes.
And part of our responsibility and partnership with that is to ensure that those positions, the people that are applying for those particular positions are invested and living in that neighborhood. And that was a part of the contract on purpose so that it's not Sika coming from High Grove over into Griffin Heights and I'm trying to build some trust, but rather someone from that community that has that ability. And that is a part of the
So there'll be a
FRC.
member of the Community Leadership Council who's a paid member of the rep.
No, the engagement person.
Oh,
The Community Leadership Council is a volunteer
oh,
and they will help to staff that, but the paid person is right. So
But will
that I just
also be
wanted
a
to.
member of that community. And that was, again, part of your original proposal. But again, it helps because I was, you know, at every
I
stage.
just want to share, we're going to lose some members in about 15 minutes. So I'm going to ask you to, not to hurry, just kind of a little bit. Then we'll go to Mr. Hannah. All right.
So, who built the budget? Yeah, who built the budget? All y'all together collectively?
So we all had input. We do have somebody on Teams.
So I'm looking at the budget, there's a senior director position at 0.67 for 8.5 months at 35,000. Looks like about 50% of the 600,000 is salary and benefits of these handful of people, 316,000. Of one, there's a senior director for $35,200 for 8 months. There's a resource center director for 48,200 for 8.5. Are these people, are they currently employed with you all or no?
No, they're
They're
not.
not. So do you think you're actually going to be able to find somebody that's going to leave their job or not have a job to hire them as a senior director for $35,000 in an 8-month contract, not knowing if they will have a job after 8 months or not?
It's our goal to provide a solid proof of concept. We're committed to doing the work. So it's our intention to do well if we move forward in this process so that we can really continue the services.
Mr. Hannah, just to follow up on that, if they don't spend the money, first of all, the funds are released, if I read this correctly, in 3 tranches. At any point along the way, I mean, you have to have deliverables met for a tranche to be released. And if they haven't met those, and in this case, if they're not able to hire people quickly enough, that that money will flow back in, well,
So I
it
see,
is always in our coffers.
so I see that senior director Leon County is 0.67 for 8.5 months. I'm not sure why they're 0.67, but the director here is a full FTE for 8.5 months.
It's 0.67 because I don't know if Andrew or Jarvis mentioned earlier, we do have another family resource center in Putnam County. So to really focus on continuity of services, the expectation is that that senior director will also be engaging in managing that Putnam County as well. Again, so that we'll have,
Okay, so that is a
Anticipated.
person that is currently employed.
no, it's not.
It would be a full-time position of which we would pay 0.67.
And the other would go to Putnam County.
And Putnam County would
And then the
pay.
three, and I assume the other people you're talking about are the 3 FTEs for the community engagement, those 3 individuals who actually live in those communities. is what you're
Yes,
saying?
yes. And thank you for that question.
And then there was a, what, $28,000 or $30,000 investment, capital investment here?
Yes. And that was based on the build out information that we received.
Yes. That number was provided by CSC staff for it will have a slight expansion in the space behind this room. To accommodate for the offices, the family resource room.
Okay. All right, are you done? I think you, all right, Mr. Mitchell.
Okay, there is talk, we're talking about, you're gonna come back in September with what you found out and making recommendations for next steps that the council will decide on. It, to me, and this is just something to consider, there are, as you look at the map that Holly put up, there are, the color is based on sort of an intensity of need, but it's not, it doesn't reflect necessarily the resources that are already being committed to that area. And so when you guys do come back, I think it will be important that you're balancing both. It may come out to the same answer, but I just want to make sure that communities that may not have as strong of a need but have 0 resources being committed to them are not overlooked. So, okay. So that wasn't even a question, how about that? Parent education. Again, this is part of your proposal, the course services descriptions. I'm curious about the techniques, like, because I really think this is important. Again, these are parts of your proposal that were most moving to me. What do you all have in mind in terms of parental education and parental involvement?
I feel like that's a broad question. Can you be a little bit more specific for me?
Maybe it's reflecting on what you all did in the community partners school.
Actually, yeah, let me just speak more from the early learning perspective, because we do a lot of parent education in our programs. We have used an evidence-based model called Nurturing Parenting Program. That's one that's very common out there. But again, as we learn about the community, there might be a better model for us to implement, but we do have experience in implementing parent education.
Answer, done. Okay, see how good I am. I only have one more, I swear. So, on page 26, you all talk about, a program you ran with the Rosen Foundation, fantastic organization, supports another board I sit on. I love all they do. I am curious though about, you talk about, CHS intends to replicate this effort through the family resource centers with the in-home childcare owners in each neighborhood. And the childcare providers in-home and in commercial operations, I want to make sure that we are certain that these are those who have been vetted and certified by DCF and are on the approved early learning coalition.
Registered.
That's, I hear them, I'm just looking
Absolutely.
at the, getting our money. I'm done. Thank you so much. Thank you for entertaining me.
Thank you so much. All right, I don't see any additional tents in the room. I do want to check with our esteemed Mr. Vice Chair. Terrence, do you have any additional questions for? No, for now?
No additional questions. Thank you.
Of course. Okay, thank you very much, Terrence. I appreciate that. All right, thank you all once again. We didn't want y'all to be on the hot seat, but we did have some questions, so we really appreciate you all being here to answer those questions. All right, so I hope that we are in a position where we have gotten our questions answered and we're ready to move forward with the decision on this contract.
Just from, thank you. I just want to make sure that Mr. Jones is back.
That was the next thing. We are now open for public comments. So, Ms. Clay, do we have anybody here that has any public comments? Okay.
We have one public comment.
I'll be quick, y'all.
No worries.
But as the director of the Learning Pavilion, a smart play preschool, that's partnered with Goodwill Industries Big Bend. Oh, Kim Simon. That's who I am. Anyway, we serve kiddos from 6 weeks to 6 years of age, and we focus on kids with developmental disabilities, developmental delays, and provide on-site therapy services, as well as providing kids. Sorry, Holly, you distracted me by the camera. Anyway. I just wanted to say that in this field, it's not only about the high quality curriculum and the high quality teachers, it's also about being able to connect families to resources that has made such a difference in watching our kiddos get ready and be prepared for kindergarten. And that any investment that replicates that kind of mindset is definitely worth it here in Leon County. And as part of Goodwill Industries Big Bend, and CHS, we are here and ready to partner in this effort, whether it's employment and job readiness seminars or parent education classes offered at the Family Resource Centers. So stay tuned. I'm excited, you guys.
Awesome. Thank you very much. Thank you. I think Mr. Jones has a question. Do you have a question? Okay,
Is that the last public?
that's the last. Is that our only public?
There's no more public comment.
Okay.
Yes, so I would never dare do this at a school board meeting, but I'm gonna do it in this meeting. Talitha, you've been sitting here for 2.5 hours now. You drove all the way over here. But you're not, you want to comment about this proposal? Do you have a community perspective for this proposal?
Well, she has maybe, and she's a provider in this, she's part of the.
Are you on the board for CHS?
She's an interim review.
Full time.
For a whole child.
She's rocking it and I keep, but how,
She's part of it.
listen,
Huh?
I was just listening.
Yeah, she's here as a part of the.
But I haven't.
And so Jay,
They're
you're
providing
here,
services.
and Talithia is here on behalf of.
She's here as a part of the screening of the application.
Supporting.
So that's what I'm asking. In full support of this proposal.
Let me present up.
Can you?
We need to, and we need to get a speaker's card.
Yes, speaker's card. Speaker's card.
No. You can do it afterwards. You can do it afterwards.
We asked her to come up there.
Yes.
So my question is, you've seen this proposal about coming out of here as a hub. I trust and value you, you don't live around here. I know where you live. Do you think this is gonna be something that's gonna benefit our community?
I thank you for calling me up here. My presence today is not as a full-fledged community member. I am standing in the position as the interim director, executive director for Whole Child Leon, who is written in this proposal as a partner with CHS. So the Whole Child Leon organization is in support of.
Thank you very much. Thank you for being called to the floor. By Superintendent, thank you so much.
I had no idea she was the interim director.
No worries.
I missed that memo.
All right, we'll hear from Mr. Jones and then we will move forward with the vote.
Yes, Madam Chair,
Yes.
colleagues, and to our guests, allow me to provide explanation today. We have Leon County Commission meeting, of which I am a staff person, and I had agenda items that were before the commission, and so those agenda items were satisfied. I wanted to explain my tardiness. I also want to say that I am very much impressed with the children's Home Society, and what I know has been their very impactful work. Particularly what I have seen them been able to do, particularly at one of my Title I schools in my district, and have been impressed so much, in fact, that I know that the superintendent and the members of the school board are looking to replicate that same model at some of our other targeted schools, such that they can have that impact. So I can imagine that they will identify the persons that will help to bring them even more community cachet and buy-in as we look to this model. I will admit that I'm not entirely sold on the methodology or the method or bureaucracy that brought us here. But the beauty of the Children's Services Council is that we will try to do that common thing in uncommon ways. We have done the traditional relationship between governmental agencies and not-for-profits. We have not seen anything quite like this model that I can recall, having been funded, having been a part for 2 decades now of the CHSP model. And we have not seen this type of model. So I'm hoping that the type of oversight and engagement that will come between our staff and theirs will be able to provide us with the type of ultimate outcomes that we want, particularly when Mr. O'Brien reminds us of the significant amount of money that we're talking about managing here. So I'm happy that we've had this conversation because it has helped to inform my perspective more greatly about what I believe could possibly be a very successful collaboration.
Well, thank you very much for your comments, Mr. Jones. We appreciate that. Thank you very much. And that's why we thought it was very important. I did not see you. We thought it was very important that you all be here because I think we needed that face to face. So thank you so much. Mr. Mitchell.
Yeah, one thing, and it's been on my mind for a while. And it's been talked about by several members of the council, and I think appropriately so. Before the second iteration of this ITN, there was a first.
Yes.
And that's why I asked Ms. McPhail to please do a chronological timeline of what got us here. In that first, there was one respondent who was certainly
Qualified.
Better than the other. For whatever reason, I wasn't part of the evaluation team, whatever reason, they decided not to move either forward. That's all part of the record. Here's what I will tell you though. I read that proposal and I just reread it because like your first proposal, I kept getting confused. Like, who said that in Whole Child Leon's? I reread them all. There are some nuggets in the Bethel proposal that I would strongly recommend you all look at. And there is one person in particular, and I'm sorry if their name is escaping me, but who might be someone you want to talk to about the Frenchtown community. And that's one of those areas. So, okay, thank you. So.
Linda Fortenberry, Dr.
Yeah, okay. So I throw that out to you. And with that, Madam Chair, I would like to move that we sign a contract. I for God's sake, do we do a resolution?
No, we just need a motion.
There's your motion.
We feel like, all right. So we have a motion from Mr. Mitchell. We have a second by Mr. O'Brien. Thank you so very much for that. It is now time for a vote. Time for a vote. Yes, Ms. Clay, will you please do a roll call vote for us?
Mr. O'Brien,
Yes.
Mr. Jones.
Yes.
President Hannah.
So, look, it's no secret, I've been struggling with this. I really have, but if Paul, Member Mitchell made the motion, I trust your judgment. And
What about the rest?
I trust. I trust your judgment. Financial.
Thank you.
Overseer, the oversight. But it seemed like, okay. Yes.
Yes, okay, thank you, Ms. Clay.
Mr. Mitchell,
Yes.
Mr. White.
And since Dr. Jones talked about tardiness. I just want to apologize. I'm in Orlando, in another room. We were doing the negotiations down here, so sorry I couldn't be there. My vote's a yes.
And Dr. Glenn.
Yes, so, wow, we have a contract. You all still be here, you know what, y'all have walked through the fire and y'all have come for it. Thank you all so very much for being here. All right, so do we have any other member comments? I think we remember commented out, so thank you very much.